All right, thanks everybody for joining us today. We are Benefits in Action, bringing you Social Security 101 basic information of all those different programs. I'm Rachel Wise, Manager of Marketing and Communications, just here for some support today, and I'll turn it over to our host, Eric Gonzalez.
Nice to meet you all. My name's Eric Gonzalez. I'm a project manager, and I'm happy to talk to all of you about Social Security today. And with me is Rose Paz, a Social Security navigator who's been kind enough to provide our interpretation into Spanish. Okay, so here is our agenda. Up first, who is Benefits in Action? Then why Social Security? After that, a brief Social Security overview, followed by a deep dive into the Social Security programs. Then we will talk about income, assets, and resources, how to apply, what happens if you are approved or denied, contacting Social Security, some frequently asked questions, and then there will be time for your questions.
And we thank you for your patience during the pause as our interpreter shares the message in Spanish.
So, Benefits in Action is a Colorado nonprofit dedicated to connecting individuals to the community resources needed to thrive. We specialize in food and health benefit application assistance programs such as Medicaid, SNAP, Medicare, and Connect for Health Colorado. We help people apply for Social Security benefits on a case-by-case basis. The decision to take a case is based off evaluation of medical evidence. So why Social Security? And the answer is simple. People need money and often cannot earn a living wage for various reasons, including age and disability. And those who do work often don't earn enough to adequately save for retirement. So, a brief Social Security overview. Social Security provides unrestricted cash funds in limited circumstances if you qualify for one of their programs. So, programs are retirement, disability, family, survivor, and supplemental security income. Programs are operated by the Federal Social Security Administration. You can apply online at www.ssa.gov or by calling 1-800-772-1213. And you generally can only receive one type of Social Security benefit. So Social Security retirement. To get Social Security retirement, you have a requirement of work history paying taxes into Social Security. You need 40 quarters or 10 years of work history to qualify. Social Security retirement provides a fixed monthly income for life. Full retirement age is 67 for those born in 1960 or later, but you can take your retirement benefits as early as 62 with a penalty or as late as 70 with a bonus. And you can sometimes apply based off another person's work record. Now, Social Security disability insurance is a little different. It assists adults with a disability lasting at least a year. Now, taking SSDI is the equivalent of taking retirement early due to your disability. And like retirement, you must have worked and paid taxes into Social Security to qualify. Most individuals must have worked 5 out of the past 10 years prior to their disability onset to qualify. A little bit more about the SSDI program. So to qualify, you must have a disability as defined by Social Security. The disability is dependent on your medical signs and symptoms, not just diagnoses. And the disability must be expected to last at least a year or result in death. You must not be engaged in substantial gainful activity. In 2026, that is defined as earning $1,690 a month or more before taxes. And you can apply on another person's work record for SSDI in limited circumstances. So supplemental security income is a different program for folks with disability or who are aged over 65. It is a needs-based program for those over 65 or who have a disability. It uses the same definition of disability as SSDI, and you must have low income and less than $2,000 in assets or resources to qualify. If you're married, that limit increases to $3,000. So a little bit more about the SSI program. For supplemental security income, work history does not matter if you're a U.S. citizen, and legal permanent residents can apply if they have enough work history in the United States. Adults and children can qualify for SSI, but the catch is that parental income and assets are applied to children. And SSI is a program of last resort. That means that to get SSI, you must also apply for all other assistance programs for which you may be eligible. So what is income? It depends on the program that you're applying for, but when you're applying for the Social Security Disability Insurance, SSDI program, income is anything you as an individual earn as wages or net income from self-employment. It does not include passive income such as interest or dividends. It does not include unearned income such as VA benefits, and it does not take anyone else's income into account, only yours. Now, for the Supplemental Security Income Program, the definition of income is much different. When applying for SSI, almost all earned or unearned income you receive counts as income. Some examples are wages, net income from self-employment, interest and dividend income, unearned income from a private pension or government benefit, rental income, deemed income, alimony, and some child support, settlement funds, and financial support you receive from family or friends. So what are things that are not income? Income does not include the following: income tax refunds for 1 year following receipt, retroactive SSDI or SSI back pay for 9 months following receipt, loans spent in the month received, SNAP, and money paid directly to a third-party provider for supports. So, for example, money paid directly by a third party to a utility provider for your support, rather than money given to you for you to pay the utility provider.
Uh-oh, her microphone. Rose, you're on mute. I just realized.
Now, the definition of assets and resources. Basically, it's anything you can convert to cash other than your primary residence, your primary vehicle, and your personal possessions. Some examples of what are assets are cash, bank accounts, stocks, bonds, and mutual funds, annuities, retirement accounts, and most life insurance policies. How to apply, and that's a key question. Well, you can get assistance from Benefits in Action or another organization, but shop around. Not all organizations provide the same services. And some organizations charge, but some do not. You can apply online at www.ssa.gov, or you can call Social Security to schedule a phone or in-person appointment with them. So what happens if you're approved for the Social Security Disability Insurance Program, SSDI? Well, first, your health insurance status may change based off your approval. SSDI provides a pathway to Medicare after 24 months from the date you are deemed disabled. ALS and end-stage renal disease provide an immediate pathway to Medicare once approved for SSDI. And if your SSDI payment is above the regular MAGI Medicaid income limit, then you no longer receive or will qualify for Magic Medicaid. but you may be able to apply for the Medicaid buy-in, and we can help with that. Now, if you are approved for the Supplemental Security Income, SSI program, it does not get you to Medicare, but does automatically qualify you for Medicaid. And you can always call Benefits in Action to apply for Medicaid once approved. And you're eligible for Medicaid if you're receiving even $1 of SSI. Now, if you are denied benefits from Social Security, you have 60 days from the date of the denial to appeal. And there are 4 ways you can appeal a decision, but they have to be done in sequential order. First is the request for reconsideration. Second is review by an administrative law judge. Third is a review by an appeals council. And fourth is taking the case to federal court for review. And if you've recently been denied, call Benefits in Action for help. Now, contacting Social Security. And I put exactly one photo in this slide, and it's a photo of Mount Everest, because in all honesty, contacting Social Security can be difficult. But here are some tips. Call 1-800-772-1213 or your local field office to schedule appointments. Call early in the morning and you'll maximize your chance of getting a live representative. And you can call later in the week or month to also maximize your chance of getting a live representative. Now, frequently asked questions. These are some that we get sometimes. Number one, can I work and receive either SSDI or SSI? The answer is yes, but generally only if your gross monthly income is $1,690 or less. So remember that SGA we were talking about earlier. You can't exceed that. Can I get retirement and SSDI? No. SSDI is taking your retirement early due to your disability. They are mutually exclusive. Can I get retirement and SSI? Yes, but only if your retirement is 1,014 a month or less and you meet the SSI asset requirement. Can I work with benefits in action if I have an attorney on my Social Security case? No, but we can help you if you are not represented by anyone else. And can BIA benefits in action expedite my Social Security case? Unfortunately, no. The decision to expedite a case is up to Social Security. We can only advocate for it. A few more frequently asked questions. Does everyone get denied for SSDI or SSI the first time they apply? No. The decision to approve or deny a case depends on a lot of factors. There's no automatic denial rule. Can Benefits in Action update my information with Social Security or give me a status update? Generally, no, but we can if we have signed a Social Security approved representation agreement with you. Can Benefits in Action do applications for survivor's benefits? No. Social Security requires that all survivor benefits applications go through them. How long does it take Social Security to process an SSDI or SSI case? Generally between 9 to 12 months, unless the condition is terminal. And can I receive SSDI or SSI benefits while incarcerated? And the answer is no. Benefits are suspended after 30 days of incarceration and terminated after 12 months of incarceration. Now, what are your questions? And this is honestly the most fun part, so feel free to take yourself off mute, put something in the chat. We're happy to answer whatever questions you have.
It's a Q&A,
Hmm.
where folks can drop their questions in, and if we can answer those today, we will. Sometimes it's a more individual, personalized question, and we definitely recommend that you connect with us for an appointment in that case. Okay. So I'm looking, I don't see anything right now in Q&A. Let's go ahead. See your thank you slide. We'll hang out for a couple of minutes though if there are any questions. So thanks for joining us today. You'll see there on the right side of the screen, we are on Facebook, Instagram, and LinkedIn, as well as hosting our website where you can find information. We do share regular program updates, information about our events, and more there as well. So please do follow us on social media, and come out and join us for some of our events. Just as a reminder, if you need help applying for or renewing your SNAP, Medicaid, Social Security, or other benefits, please call us directly at that number there on your screen. That's 720-221-8354, so we can schedule an appointment for you. You can also visit benefitsinaction.org to learn more about our work and our other webinars. I mentioned we have one tomorrow. And we do have some other events coming as well, so please do visit our website. I do see a couple things in Q&A, so I'm going to check those. Okay. Someone asked, can you apply for SS at any age? And I think that might be too vague to answer us.
No, no, that's actually it's a good answer to that. It's a very good question, actually. The answer is that it depends on the program for Social Security. Now, Social Security regular in retirement, you have to be 62 or older. And then SSDI is for adults aged 18 to 66. But the Supplemental Security Income Program, you can get it at any age. From birth, you can be 100, you could also get it.
And the next question, can you explain the four levels for the appeal process in more detail?
Sure. So the four levels of the appeal process start off with your request for reconsideration, which is basically a new or different part of the Social Security Administration, so a different division in the office, looking at your application as well as any new evidence you submit. Review by an administrative law judge is when you actually go to court, either virtually or in person, in front of a judge and give your testimony, and they take that into account as well as making a completely new decision about your case. So they are not bound by Social Security's prior decision. The appeals counsel review is if the administrative law judge gives you a denial, it's a council of people who can review that decision. Generally speaking, they just send it back to the judge for further analysis, but they could reverse it outright. Oftentimes, though, they just approve what the administrative law judge says. Now, the final level is taking it to federal court. That's a little different. That's when you have to get like a licensed attorney and go pay the filing fee for federal court and go into district court to have a federal district judge, Article 3 judge, look at your case and decide what's going on.
Nice. Okay, last question. And if you have more questions, please drop those in the Q&A box. Otherwise, call us directly. On the SSI continued slide, you stated, quote, SSI is a program of last resort, must apply for all other assistance programs for which you may be eligible. What are some of those programs?
Oh, easy. So, for example, they are usually other Social Security programs. So, if you're 62, let's say, and you want SSI, you would have to apply for Social Security retirement first and take it early with the penalty before being able to get SSI. Similarly, if there's another program that could give you financial assistance, excuse me, Like VA benefits, you would want to apply for that first. And in many cases, doing those applications first may give you enough money to put you over the income limit for SSI and negate any SSI you would otherwise receive.
And can folks call us if they have more questions about that? Programs are available, Eric.
Yeah, of course. Definitely.
I'm not seeing any open questions. Um, please do check our website to register for the health benefit options webinar tomorrow. Again, we will post these on our YouTube channel. They'll be available on our website. So you will also get this recording because you registered for the session today. But this one and the other webinars will be available. And don't forget to come to Drag Bingo for benefits tomorrow night at Hamburger Mary's. Doors open at 5:30 p.m. and bingo begins at 6 p.m. This is a 21 plus age event. Some of our events are a little bit more family friendly. We are trying to do a bunch of fundraisers and events that bring our community together with something for everybody. So stay tuned, visit benefitsinaction.org or call us directly if you need help applying for benefits or have questions about your benefits. Thanks so much for joining us today and have a great rest of your week.
Yeah, thank you so much.